بسم الله الرحمن الرحيم. Antiviral treatment in COVID-19. The World Health Organization has declared a public health emergency of international concern in response to the novel coronavirus outbreak, which was first reported from Wuhan City in China. Up till now, no medication is recommended to treat COVID-19, and no cure is available. Antibiotics are not effective against viral infections, such as COVID-19. Researchers are testing a variety of possible treatments. The FDA has granted permission for medication approved for other diseases to be used to treat severe COVID-19 when no other options are available. Remdesivir, an investigational antiviral drug, is available through an FDA emergency use authorization. زي ما قلنا إن ال FDA granted a permission to use some medication that are used for other diseases to be used في ال COVID-19 زي الازيثرومايسين. الازيثرومايسين ال FDA approved indication بالنسبة له هو بيستخدم في المايكوبكتيريال نون تيوبركلوز انفكشن وفي ال various bacterial infection. But it has a proposed antiviral effect through induction of the interferon stimulated gene attenuating the viral replication. Azithromycin, especially if used with the hydroxychloroquine, chloroquine, it can have an additive effect with these drugs that prolong the QT interval. وعشان كده baseline follow-up ECG is recommended. Other adverse effects with azithromycin gastrointestinal effects like diarrhea, nausea, vomiting, and also it has a hepatotoxic effect. Other drug, chloroquine. The FDA approved indication for chloroquine is malaria and extraintestinal amebiasis. It has a proposed antiviral effect in vitro by increasing the pH of the intracellular vacuoles and altering protein degradation pathways, thereby interfering with the virus cell fusion and glycosylation of cellular receptor. It inhibits glycosylation of the cellular angiotensin converting enzyme to receptor, which may interfere with the binding of the virus to the cell receptor. The adverse effect of the chloroquine, the most important here, prolongation of the QT interval, AV block, ventricular arrhythmias, especially if it is taken or it is given with concomitant QT prolonging drug زي الازيثرومايسين. We have to do a baseline and follow up ECG for these patients. أو كمان لو البيشنت عندهم underlying cardiac disease. Another important adverse effect for the chloroquine هو الهيموليسيس. الهيموليسيس اللي احنا بنشوفها في البيشنت with the glucose 6-phosphate dehydrogenase deficiency. we have to perform G6PD testing before giving chloroquine in these patients. It is not recommended to give this drug in those patients. We have to consider using hydroxychloroquine instead of the chloroquine while waiting for the test results. Other adverse effects like gastrointestinal tract effect, nausea vomiting, ممكن يعمل hypoglycemia, especially لو ان احنا بيبقى مع الانتراكشن مع other drugs with اللي can lead to hypoglycemia. It can lead to myopathy and rash. كمان الكلوروكوين is moderate inhibitor of the cytochrome P of the cytochrome and also for the P-glycoprotein. So we have to be cautious when administered the drug with the medication that metabolize the cytochrome to G6 زي الانتي-psychotic والبيتا blockers. أو الدراجز اللي هي transported by the glycoprotein زي الانتيكواجولانت او الديجوكسين. الهيدروكسي كلوروكوين approved by the FDA for lupus erythematosus, malaria, and rheumatoid arthritis. The proposed antiviral effect is like the chloroquine. It has an in vitro antiviral activity by increasing the pH of the intracellular vacuoles and altering the protein degradation pathways, thereby interfering with the virus cell fusion and glycosylation of the cellular receptor. Hydroxychloroquine and chloroquine have a similar toxicity profile, although hydroxychloroquine is better tolerated and has a lower incidence of toxicity than chloroquine. The risk of QT prolongation is more with the chloroquine than with the hydroxychloroquine. LOPINAVIR-RITONAVIR اللي هو الكاليترا. ال FDA approved indication هو ال HIV. ال proposed antiviral effect, we know that the replication of the corona virus depends على ال cleavage of the polyproteins into an RNA dependent RNA polymerase and helicase. The enzymes responsible for this cleavage are two proteases. الأولاني هو 3-chymotrypsin-like protease and papain-like protease. LOPINAVIR-RITONAVIR is an inhibitor for the 3-chymotrypsin-like protease in vitro. As regards the LOPINAVIR-RITONAVIR adverse effect, it can cause nausea and vomiting, diarrhea, can cause elevation of the transaminases enzymes of the liver, also the prolongation of the QT interval and the PR interval prolongation. So we have to do transaminase level and consider monitoring the ECG when LOPINAVIR-RITONAVIR is given with other QT prolonging medication. The LOPINAVIR and ritonavir is a potent inhibitor of the cytochrome 3A, and many medication metabolized by this enzyme may cause severe toxicity if it is taken with the LOPINAVIR-RITONAVIR. There is wide experience with the use of LOPINAVIR-RITONAVIR in pregnant women with HIV, and the drug has a good safety profile. No evidence of human teratogenicity. It has a low placental transfer to the fetus. In children, LOPINAVIR and ritonavir is approved for the treatment of HIV in infant children and adolescents. There are no data on the efficacy of LOPINAVIR-RITONAVIR used to treat COVID-19 in pediatric patients. Interferons. Interferons are a family of naturally occurring proteins that are made and secreted by cells of the immune system. For example, white blood cells, natural killer cells, fibroblasts, and epithelial cells. 3 classes of interferons have been identified: alpha, beta, and gamma. Each class has many effects though their effects overlap. Commercially available interferons are human interferons manufactured using recombinant DNA technology. Interferon beta currently in use to treat multiple sclerosis, and interferon alpha are both under investigation as a potential treatment for people with COVID-19. Interferon beta. The mechanism of action of interferon is complex and is not well understood. Interferons modulate the response of immune systems to viruses, bacteria, cancer, and other foreign substances that invade the body. Interferons don't directly kill viral or cancerous cells. They boost the immune system response and reduce the growth of cancer cells by regulating the action of several genes that control the secretion of numerous cellular proteins. The most common side effects of interferon beta are injection site reaction, flu-like symptoms, headache, muscular ache, nausea, pain, fever, and diarrhea. Another study that combined the use of interferon beta 1 and LOPINAVIR and ritonavir and ribavirin, which is the anti-hepatitis C drug for the treating patient with COVID-19. It is found that early triple antiviral therapy was safe and superior to LOPINAVIR-RITONAVIR alone in alleviating symptoms and shortening the duration of viral shedding and hospital stay in patients with mild to moderate COVID-19. Future clinical study of a double antiviral therapy with interferon beta 1 as a backbone is warranted. Remdesivir. The FAG approved the remdesivir for the treatment of the Ebola virus. Remdesivir is an adenosine nucleotide analog prodrug that undergoes hydrolysis to its active form. Remdesivir binds to the viral RNA-dependent RNA polymerase, inhibiting viral replication through premature termination of RNA transcription. Remdesivir is the first drug to be approved by the FDA as an emergency drug in the COVID-19. It is recommended for the hospitalized patients with severe COVID-19 with oxygen saturation equal or less than 94% on the ambient air at sea level, or those who require supplemental oxygen. And also, it is recommended for treatment of COVID-19 in patients who are on mechanical ventilation or extracorporeal membrane oxygenation. There are insufficient data to recommend for or against remdesivir for the treatment of patients with mild or moderate COVID-19. The duration of therapy of remdesivir in patients with severe COVID-19 who are not intubated, they can receive the drug for 5 days. There are insufficient data on the optimal duration of therapy for mechanically ventilated patients or patients on ECMO, or patients who have not shown adequate improvement after 5 days of therapy. In these groups, some experts extend the total remdesivir treatment duration to up to 10 days. The important side effect of the remdesivir is transient elevation in the liver function ALT or AST level. وعلشان كده لو هو بيبقى contra indicated لو ال ALT أو ال AST is more than 5 times the normal level. Also, the important side effect of the remdesivir هي الإفكت على الديناميك تعمل renal impairment. عشان كده don't administer remdesivir لو الجلوميريول filtration rate less than 30 milliliter per minute أو لو ال patient is receiving dialysis. A recommendation for the use of the remdesivir in pregnancy. It can be used in pregnant patients only when the potential benefit justifies the potential risk to the mother and the fetus. The safety and the effectiveness of remdesivir for COVID-19 treatment have not been evaluated in pregnant patients. Remdesivir should not be withheld from pregnant patients if it is otherwise indicated. The safety and effectiveness of remdesivir for COVID-19 treatment have not been evaluated in pediatric patients. Gilead received FDA approval to begin clinical trials of inhaled version of remdesivir. An inhaled formulation would be given through a nebulizer, which could potentially allow for easier administration outside the hospital at earlier stages of the disease, which could help stem the tide of the pandemic. Remdesivir is now available in Egypt, and it is manufactured by EVA Pharma. Favipiravir. Favipiravir, also known as Avigan or Favilavir, is an antiviral drug being developed by Japan. It is an oral antiviral approved for the treatment of influenza in Japan. The mechanism of its action is thought to be related to the selective inhibition of viral RNA-dependent RNA polymerase. Other researchers suggest that Favipiravir induces lethal RNA transversion mutation, producing a non-viable viral phenotype. Avigan has become the first ever antiviral medicine to be approved for use as a treatment for COVID-19 in China. The National Medical Product Administration of China has approved Favilavir for treating the now declared pandemic illness after it appeared to be effective in coronavirus patients during clinical studies. It is available in both oral and intravenous formulations. The patient insurance who were administered Favilavir turned negative for the coronavirus after a median of 4 days after becoming positive, as compared to a median of 11 days for patients who were not treated with the drug. Additionally, X-rays shows improvements in the lung condition of 91% of the patients who were administered Favipiravir as compared to 60% of patients who were not treated with the drug. Despite its potential, the FDA has not yet regarded Favilavir as an effective treatment medicine for coronavirus. Nevertheless, doctors in Japan are said to be conducting clinical study of Favilavir on coronavirus patients having mild to moderate symptoms in hope of preventing the virus from multiplying in the patient. في فبراير 2020 الفافيبيرافير was being studied in China في USA في ابريل 2020 وكمان في early May في ترايل في starting في London, United Kingdom. The drug was approved for the treatment of COVID-19 in the hospital setting in Russia on May 2020 after an ongoing open-label randomized clinical trial had recruited 60 subjects on Favipiravir. According to the government clinical trial registry, this study is expected to recruit 390 subjects overall and finish by December 2020. On May 2020, the Russian Health Ministry approved a generic version of Favipiravir named Avifavir. It backed the development of Avifavir and found it highly effective in the first phase of clinical trial. On June 2020, the Russian Ministry of Health approved one more drug based on Favipiravir اللي هو اسمه Aripiprazole. The adverse effect, it can lead to decreased red blood cells production, and also it can increase in the liver function parameters. It has an also testicular toxicity. Favipiravir is known to be teratogenic, therefore administration of Favipiravir should be avoided in women if pregnancy is confirmed or suspected. There is an interaction with the metabolism of warfarin and acetyldigoxin, which can be decreased and result in a higher serum level of these drugs. Also, there is a decrease if it is taken with acyclovir and adenovir or allopurinol. It may lead to decreased excretion of these drugs. الأوسلتاميفير TAMIFLU, its mechanism of action, it can inhibit the viral neuraminidase and stop the release of virus from cells and prevent virus from crossing mucous lining of the respiratory tract. The TAMIFLU is designed to be highly specific to the influenza virus. Due to this high specificity, it is extremely unlikely that TAMIFLU would be effective at treating the coronavirus. Independent laboratory testing conducted by Hong Kong University School of Public Health demonstrates that TAMIFLU doesn't have any antiviral effect on the novel coronavirus. In mild cases, many patients with similar presentation of COVID-19 might be influenza. Hence, it is better to give the drug to avoid patient worsening due to influenza. There are a long list for other investigational antiviral agents. أنا highlight بس على الدراج ده اللي هو الأميفينوفير اللي اسمه أربيدول. ده antiviral drug that binds to الهيماجلوبينين protein. It is used في الشاينا وفي الرشا to treat influenza. في study that compared اللوبينافير-ريتونافير واليوميفينوفير monotherapy with standard care in patients with mild to moderate COVID-19. This study showed no statistical difference between each treatment group. In India, a phase 3 trial combining the two antiviral agents, الفافيبيرافير والأميفينوفير, started in May 2020. Other investigational drug زي الميريميفوديب، نيكلوزامايد، رينتاسوليمود، بيتا هيدروكسي سايتيدين، فيمسنتينيب، بيليسيديبين، بير 2703، إيد 2801، methyl hydrochloride, and the last one ET527. Thank you for your attention.